Now, you might have noticed wherever you are in the country that emotions are running pretty high at the moment, especially among Victorians. And as Melburnians dive into another week of COVID lockdown, we're told it's quite normal to be feeling upset, anxious, frustrated, or a mixture of all three.
So how do we manage the situation? Well, we're joined by Christine Morgan, the CEO of the National Mental Health Commission. Christine, great to have you on the program this morning. What are you hearing about how people are doing in Victoria?
Oh, look, they're doing it tough. And look, could I just start, Lisa, by saying that, please, to all of our friends, families, colleagues in Victoria, gosh, you must feel as though you're alone, particularly in Melbourne, but we really are pushing you forward from our perspective. We're really feeling for you. It is doing it tough. And I think, Lisa, all of those things you've said, it's to be expected that as we go into further restrictions, all of those feelings of anxiety, concern, what can lead to psychological distress, kick back in. And it's happening at a time when we are all suffering, I think, from pandemic fatigue. We are just so emotionally low at the moment.
Yeah.
It is really tough to bring ourselves up and reach out for help.
It's okay to be not okay, isn't it?
Look, it's absolutely okay to not be okay. The thing I'd say, though, what's not okay is to not reach out for help. Because one of the things that we really have learned over these last horrific few months is that our mental health is part of us. We get that. We know it can be negatively impacted. But the thing that makes a difference is when we reach out for help. The services are there and they do actually make a difference. So as low as you may feel, as unable as you may feel, just take that first nano step of reaching out and saying, what can I do to try and get through this?
There are so many things that are out of our control, though.
There are so many things out of our control, and I think one of the ways to try and navigate this, and this is where our support lines and our mental health experts can really try and get alongside people, is to say, what are those strategies you can do to help yourself? And one of the most important things, it sounds fudgy, it sounds soft, it sounds warm, but it's really critical, is look after those things that actually give you some degree of pleasure or joy. As you feel a sense of, I'm not in control of things, what are those things I can control? How can I invest in looking after myself just today? You know, is it taking a bit of time out? Is it reaching out to a colleague or a friend or a family member to have a chat? Or is it just sitting with a cup of tea? They sound simple things, but they're really fundamental to actually saying, OK, in this time when I'm feeling out of control, I'm feeling anxious, I'm feeling concerned, what can I do for myself?
And I guess the basics, sleeping, exercise, looking after yourself, eating well.
Absolutely. All of those things. And for those people who are really challenged by and dealing with mental illness, mental ill health, you also will feel the additional strains and stresses of what's happening. So stay connected with your mental health practitioners. It's really important. There is a pathway through. We are all there to support you. We get the fact that you're so tired and fed up, it's hard to reach out, but just make that first step and we're going to meet you there and actually help you through.
Christine Morgan, thanks for your words this morning. I'm sure Victorians appreciate them.
Thank you so much, Lisa.
And if you or someone you know is experiencing distress, you can contact Beyond Blue on 1300 22 4636 or Lifeline on 13 11 14. There's also a free support available 24/7 at headtohealth.gov.au, so check that out as well.